For more on this report, let's bring in Dr. Sarthak, CEO of Asia Pacific Leaders Malaria Alliance. Well, thanks for joining us, Dr. Das. Well, good to know on the plus side, let's be optimistic here. It's good to know that the worst case scenario, that has been averted. The numbers have sort of stabilized. So perhaps tell us what went right.
So what went right was that what the world expected was that there would be massive disruptions in our fight against malaria as a result of COVID. And what we saw was governments and national malaria programs being able to be resilient, being able to innovate, and being able to, in sum total, find a way to prevent what was predicted to be a catastrophic outcome in terms of increased incidence in malaria across the globe, and particularly in our region. So we know what went right, but what went wrong, though, especially in countries that didn't distribute enough of those life-saving insecticide-treated bed nets? And I believe Indonesia and Thailand, for example, they were singled out for distributing less than 60% of those. So, what were some of the obstacles there? So I think the obstacles that we saw in Indonesia, and we've also seen an increase in cases in Myanmar, and obviously in Myanmar that's due to other factors related to geopolitical tensions. But in terms of Indonesia, it really came down to the distribution of nets. But I think the more important narrative is in this story is in terms of Asia Pacific. You led off with some statistics in regards to the global burden of malaria being 95% to 96% in Africa. But for us in Asia Pacific, we still have 12,000 deaths according to this report. That's 3 deaths every 2 hours. And when we think about what this region has been able to accomplish, a 70% drop in deaths in the last 20 years. And given the elimination of malaria in countries like China and Sri Lanka, there is no reason as we head into 2023 why this is a disease that we should still be dealing with a decade from now. We do have the tools, we do have the wherewithal in terms of programmatic knowledge, and what we need is political commitment and, as you pointed out, sufficient resources to finish the job.
And part of those resources, obviously, financing that is a big one. But what's also interesting to highlight is that the funding in 2021 came in at nearly $3.5 billion, which is actually half of what's considered a required investment. Is this then an indication that we can actually achieve more with less?
Well, I think that that's an interesting question. We certainly can achieve a lot with what we have. And I think that one of the really important things to think about is the fact that we're standing here in this moment in Singapore, which is 40 years since Singapore was certified malaria-free. We have 40 countries in the world that have eliminated malaria, many of which have done that with significantly less resources than what's available. So can we do more with less? Yes, but I think it's also important to recognize that as you strive for elimination, you strive to get to where the pavement ends. You try to get to where those last cases are. That's an entirely different set of activities that is resource intensive, both to eliminate the last reservoirs of malaria and at the same time prevent the reintroduction of malaria into a particular geography. And so that's what makes it resource intensive when we talk about disease elimination.
And also, I believe, there's a lot of research going on and development to try and bring a new generation of malaria control tools. Can you just, walk us through some of the latest technology? And also, what are the hopes of getting a vaccine anytime soon?
So as you may be aware, there was a widely publicized excellent progress on vaccines, malaria vaccines that were trialed in sub-Saharan Africa. Those were against, there are a number of parasites, 2 primary ones, Plasmodium falciparum, Plasmodium vivax. Those were targeting Plasmodium falciparum, a lot of what we have in Asia Pacific is PVivax. And at this stage, there isn't a vaccine for PVivax, although there may be one in the future. But I think that in terms of other tools that you described, there are some interesting developments around new generations of insecticide-treated nets. There's very important work going on around genetically modified mosquitoes. But at the end of the day, when it comes to new tools, I think the really important thing for us as a community in public health focused on malaria, but also as a global community, is to recognize there are bread and butter tools that we've been using to eliminate this disease, and that with really sound operational controls, that is really good public management, public health management, particularly in the places where the systems are the weakest, we can defeat malaria. It doesn't necessarily require those tools. Those tools can help us accelerate progress, and that science should certainly move forward. But we mustn't sit back and wait and think that there's a magic bullet. This is the oldest pandemic that we know. We choose to not call it a pandemic because it's happening mostly in poor countries, but it is a pandemic.
Sure.
It's probably the oldest known fever that we have, and we can defeat
Dr.
it.
Das, we are running out of time, but just very quickly, as we aim for a malaria-free world by 2030, how close are we to hitting that target? How optimistic are you?
I'm always optimistic. I think 2030 is still a reasonable goal for many countries in our region. We have a number of countries that are on the precipice of eliminating malaria, like Timor-Leste, Bhutan. Certainly Malaysia is on the precipice of certification. For the countries that have a higher burden, I think it's eminently possible. 2030 may not be the year. It could be 2032, 2033. But this is something we shouldn't be talking about 15 years from now, because we can do it. And we have the existing tools, and we just need the political leadership and wherewithal to sustain the fight.
Well, good to know. Thanks very much for your thoughts. Dr. Sarthak Das, CEO of Asia Pacific Leaders Malaria Alliance.